Hello, my name is Lucine Pashikian, and today I'm going to talk about hand hygiene and infection control. And this is my PDSA project. PDSA, or Plan, Do, Study, Act, is a four-stage problem-solving model that is used to improve overall health of care. This model is used in many hospitals to improve the quality of care while incorporating new technology and research to healthcare settings. The step of PDSA cycle requires prediction, testing, analysis, and comparison, which is perfect and easy to use in hospital settings. According to the Joint Commission, hand hygiene and infection control is a major component of national patient safety goals. Hand hygiene is the most important intervention to prevent healthcare-associated infections. The CDC, or Centers for Disease Control and Prevention guidelines, states that hospitals can reduce financial costs, morbidity, and mortality rates related to healthcare-associated infections. Issue identification. Hospitals are considered to be one of the primary locations for infectious and communicable diseases. Annually, more than 99,000 people don't survive the infections they accidentally acquire while being hospitalized as a patient in hospitals. These infections cost the healthcare system between 35 to 45 billion annually, according to Safe Care Campaign 2017. According to CDC, on average, healthcare providers do not clean their hands half of the time, and 1 out of 25 patients get at least one healthcare-associated infection daily. Hospital-acquired infections are most commonly transmitted via healthcare workers' hands. Hand hygiene is the single most important practice to reduce the transmission of infection in healthcare settings, according to Mather 2011. Hospital-acquired infections rates drop when proper hand hygiene is performed, according to a recent study by Alec Ranzi and Associates in 2013. Quality variance. The current policies and guidelines set by the Center of Disease Control and Infection, along with the Joint Commission, provide targeted tools and solutions to improve healthcare workers' compliance. Research-based evidence identifies the need for hand washing education, easy to follow guidelines and programs that are designed to help healthcare workers to overcome non-compliance challenges. Root cause analysis. Ignoring the need to improve hand hygiene increases the mortality rate for patients and will spread the disease among healthcare system. Poor hand hygiene is directly related to increased rate of patient death and nosocomial infections, according to Magnus and Associates. And this study was done in 2015. Performing proper hand hygiene reduces contact and even airborne infections, according to a study done by Hammer in 2013. The solution. The goal is to decrease the risk of infection in healthcare setting by increasing hand washing compliance through education. According to a study published in International Journal of Infectious Disease, direct observation and self-awareness increases the hand hygiene compliance. Another study revealed that hand hygiene compliance is significantly increased when healthcare workers get proper education. Using hand sanitizers can improve hand hygiene adherence from 37 to 68% and lower healthcare-associated infection rates. Direct staff observation, staff motivation can have positive impact on hand washing adherence. According to CDC guidelines, hand hygiene should be performed between each patient room visit. Create hand hygiene compliance or visual board in different hospital units. Post compliance rates every month for staff to see. Encourage staff to participate. Provide adequate staff education and training. Provide on-site teachings and demonstrations. Analysis. Create logs and daily health checks in the unit. Provide direct staff observations. Provide encouragement and positive feedback. Provide surveys to understand barriers. What are the next steps? If the goal was met, then the program can be incorporated into unit policy and be used as an example in different hospital areas. But if the goal was not met, then the manager or the team leader can modify and research other options for improvement and change. And this sums up my PDSA project about hand washing. These are my references. Thank you.